what happens when the doctor-patient ratio is unbalanced. So a lot of patients to one doctor, or in a center that is very busy and not enough hands, doctors, to serve and attend to the people who are there. If you find yourself in one of those centers, or just as a general rule, I'm giving some counsel to the streets in case you peradventure made this video. Keep this at the back of your mind. If you find yourself in one of such centers and a doctor tells you something, no matter how low his voice is when he says it, do that thing. Learn to apply emphasis to the voice of a doctor. So a lot of people, I used to tell patients, when I finish counseling patients, their eyes tend to light up and they're like, wow, I didn't know this thing. You know, this thing, it's not like it's the first time they're hearing it. But the way I word it, the way I will explain it, their eyes light up and they're like, I wasn't told this. And I asked them again, are you sure you are not told this? Okay, they said it now, but you didn't say it the way you said it. I said, man, once in a while you can meet somebody who is gifted with words, you know. Once in a while you can meet somebody who is a teacher by good day, sir. Good day, sir. A teacher by gift. Once in a while. You know, other times people come into the profession they practice with the way they are. So there are introverts. I like to use these common examples. There are extroverts. And so if you that is listening is a healthcare professional, look at your nature. You probably don't like talking too much. Probably, for example. So if somebody doesn't like talking too much, and now you're having to tell somebody something that will benefit them, and they expect you to emphasize it and repeat it 3-4 times. You see, you may not be doing that. If you do it for the first person, you may not do it for the second person. When you ask the fourth person, you're probably too tired to repeat yourself. You see? So a lot of that happens in medicine. A lot of medical counseling goes on, but with very low tone, not physical voice tone, but the emphasis level is not as much as what it should be, you know. And I don't know if it's the ideal thing. Most times the environment situation warrants that, but whatever the case is, just for the sake of your own safety, I'm going to advise you to please relate a doctor's voice. Put a microphone. Okay, add a hearing aid to your mind. Okay, let me word it better. An understanding aid, something that creates emphasis on default anytime you're in the hospital. So when the doctor quietly tells you he sent you to do an investigation, he wants you hear that thing very loud in your ears. I'm going to do it. You know, people give life-saving counsel casually in the hospitals, especially when they are overwhelmed. Do you understand? You know, in case you don't know how to spot a facility that is not properly proportioned, doctor versus patient, just in case you don't know how to do that, just make it as a general rule. You showed up to a hospital, pay a lot of attention. If you've not been paying attention before that time, because it's your health, and this person was trained, because that's what doctors grossly, we are trained to do the truth. And the practice also of the truth makes it to where you have to tell the patient the correct thing. You know, except somebody who doesn't have knowledge. And most times, because of the way the referral system is, people don't tend to pretend like they know when they don't. You know, it's easy for people to refer people to, you know. So, again, I've seen this happen way too many times. Somebody tells the patient something, I come and repeat it. They are now sweating, they are rushing to go, and even something they claim they didn't have money for, now they suddenly have money to do it for 3 people, you know. And then they also double down and tell me, I did not know this thing. Like, if they had it like this, they would have. And I'm like, you expect that man to come and do exactly what I did? I'm a different person from that man. You probably will not do that if you are the doctor yourself. You see, so take pressure off the system entirely, the entire system, and then benefit from what we are doing, you know, so that we can be able to do that. Let us take this counsel to heart. Let us do this. You know, I'm tempted to say please, as if I know the person listening, but I mean, you know, it should benefit everybody. most important is to benefit you.